Welcome to the Norfolk and Waveney Quality Improvement Training Series. My name is Jenny, and in this session we will be covering the Introduction to Quality Improvement. This training series has been developed by Norfolk and Waveney ICB and partner organisations. It is aimed at all people working within the health and social care workforce. It aims to provide people with the necessary tools and resources to undertake improvements within their own organisations using a quality improvement approach. There are lots of tools available for undertaking a quality improvement approach to improvement, and within this training series we will go over a select number. Locally in Norfolk and Waveney, many of our organisations have adopted the model for improvement, and therefore we have based our training content on this approach to provide consistency across our system. If you are watching from a general practice and participated in the General Practice Improvement Programme, you may already be familiar with quality improvement. This training will build upon the techniques learned within the General Practice Improvement Programme to enable you to make improvements in your practice beyond improving access. As long as you undertake quality improvement in a considered and systematic way, it doesn't matter which quality improvement tools, model or methodology that you use. Quality improvement is a flexible approach. And we believe that practice does not make perfect, it makes progress. And we believe that getting started and having a go at using quality improvement is the most important thing. Series is designed to be watched in sequential order and can be revisited as many times as needed. In this training series, we will cover the Introduction to Quality Improvement, identifying and understanding a quality issue, the model for improvement, stakeholders and co-production, and finally, generating spreadable and sustainable change ideas. Throughout this series, we will guide you through the quality improvement process using a mentoring approach. For those watching through the Norfolk and Waveney Connect Now intranet page, you will find templates and links to the resources covered under each video. This series has been co-developed with our system partners. So where does improvement and quality improvement fit in with what is happening nationally? NHS Impact is the new shared NHS improvement approach. It has been launched to support NHS organisations, systems and providers to have the skills and techniques to deliver continuous improvement and to share best practice and learn from one another. This will inform the way we work within the NHS going forward to create the conditions in which continuous improvement is the go-to method for tackling clinical, operational and financial challenges. When organisations, systems and providers use these 5 components, it creates the right conditions for continuous improvement and high performance, responding to today's challenges and delivering better patient care and outcomes for communities. There are lots of different types of improvement used within the NHS to improve patient care, and quality improvement is one of them. In this training series, we are going to focus on quality improvement tools and techniques, many of which can be applied to different areas, such as audit, evaluation, transformation, and beyond. Quality improvement is a distinct approach, and in a later slide we will outline the typical scenarios where it might be a good framework to use for delivering improvements to patient care. The traditional approach to improvement is led from the top down with little input from the teams on the ground or service users. It spends most of the time on designing and little to no time testing or modifying changes. Whereas with the quality improvement approach, more time is spent testing and modifying change ideas before approval and spreading. Using the quality improvement approach allows us to plan and test change interventions and ideas, so it's ideal to use when the solution to a quality issue is unknown. Quality improvement usually requires no additional funding, and it is typically undertaken on a smaller scale than transformation pieces of work. Quality improvement is useful for complex or not fully understood quality issues, and later in this series we will cover different tools which can break down problems and help teams to understand the root cause of quality issues. Quality improvement is best undertaken by people working on the front line close to the quality issue. It may involve learning new skills and approaches, but is accessible to everyone regardless of their job description or job role. Continuous improvement is an important part of working within the NHS, and quality improvement is one way of delivering such improvements. So what do we mean by a quality issue? A quality issue in health and social care is any issue which negatively impacts patient safety, timeliness, effectiveness, efficiency, equity, or person-centeredness. Quality issues can occur in various areas, including clinical practice, patient experience, and operational processes. Some examples of quality issues might include duplication or inefficient processes, long patient waits, negative patient feedback, staff shortages, issues accessing services, and many more. Improving quality isn't always the same thing as quality improvement. Quality improvement is just one of the many approaches available to use, as outlined in the previous slide. Simply, we must find the time to undertake quality improvement to make improvements to the way we deliver care. With ever-increasing demands on services and limited resources, we need to make improvements. Improvement is in everyone's job description, whether you're in a clinical or a non-clinical role, and regardless of which organisation you work for. In the Norfolk and Waveney Integrated Care System, we are all working towards the same goal, at all times being respectful, inclusive, and embracing new ways of working by being innovative and continually improving. Using quality improvement can result in improved patient safety, improved patient experience and outcomes, cost efficiencies, time savings, enhanced staff satisfaction, a reduction in the carbon footprint, and many more. Some examples of recent Norfolk and Waveney quality improvement projects have included the Glove Reduction Project, which aimed to reduce the unnecessary use of gloves across different clinical settings by raising awareness of the latest guidance to the clinicians, staff, and patients. The project has resulted in the reduction of gloves, leading to cost savings and a reduction in the carbon footprint of our local organisations. It has also resulted in improved patient outcomes. The Catheterisation Project, which aimed to reduce unnecessary catheterisation of patients, as locally it was identified that we were a national outlier. The project resulted in a reduction of unnecessary catheterisation, resulting in improved patient safety and experience, as well as cost savings. And finally, the Walking Aid Recycling Project, which aimed to implement a new procedure to clean and reuse walking aids, rather than disposing of them using the local prison workforce. So far, the project has resulted in cost savings and a reduction in the carbon footprint. These projects demonstrate that a small change can have a big impact on the way we deliver care to patients. So now we're going to do a quick exercise. Don't worry, we aren't going to make you take your shoes and socks off, but just stay with me on this one. So first, take your dominant foot and get it going in clockwise circles and keep it going. Now, with your dominant hand, draw a figure 6 in the air. Keep your foot going clockwise. How many of these can you do in 10 seconds? How are you getting on? Are you struggling? Right, keep practicing. Can you do it comfortably? What was the outcome after 10 seconds? Was it difficult? Okay, so let's look at this like a process. We are told that the outcome we need is for the foot to keep going in clockwise circles whilst drawing a number 6 in the air as part of the process. So let's think about it. We could just keep practicing and hoping that we get the desired outcome, even though we haven't changed anything. How did that practicing go? Do you think you'd get any better? Or we could think about doing something differently in the process to make it achieve our outcome. So let's think about doing something differently. And for that, we need to look at the problem. Any ideas what one of the issues here is? The dominant hand and foot being asked to go in different directions is linking back to our left and right side of our brains, asking us to do something differently. Okay, so what if we change hands and use our non-dominant hand to draw the 6? So let's test it out. How does that work? How many can you do in 10 seconds? We are still getting our outcome of the clockwise foot circles, and we're still drawing the 6, and we are getting a measurably better outcome. Great, so can we make this even better? So we know that we want the outcome to be clockwise foot circles, and we have been drawing a 6 in the air, but does it have to be a 6? We've always done a 6, so we presume that's the way it has to be. But actually, we did a bit of work to look at the process and realised that perhaps a small change, still quite similar to a 6, but a new change all the same, might give us an improvement. So let's test what happens if we draw a 7. How many can we do in 10 seconds? Has that made it easier? How about if you go back to your dominant hand instead? How many can you do in 10 seconds? And there we have it, quality improvement in a nutshell. You found a problem, looked at the process, identified changes that could make a difference, tested them out, measured what happened, and then improved something. Session 1 recap. NHS Impact is the new national improvement approach to deliver continuous improvement and to share best practice and learn from one another. Quality improvement is a distinct type of improvement, and it's important to remember that improving quality doesn't always mean the same thing as quality improvement. And finally, quality improvement can be used when the quality issue is not fully understood, known, or is complex, when there is no additional funding available, and it can be led by anyone, regardless of job role. So some things to consider before you move on to the next session. Have you identified a quality issue within your organisation or workplace? And would you like to lead improvements within your organisation? And if so, please continue on watching. In the next video, we will cover stakeholders and co-production.